Jennine Jones. Jennine Jones, a nurse on the pediatric ward, often showed extreme emotion when a child died in her room. This disturbing trait became especially apparent when one day she pulled a stool over to the cubicle where an infant had just died and seemed to experience the tragedy with genuine pain. No one likes to lose patients, but for Jones, such incidents became commonplace, for she chose to work with the most critically ill children. After marrying her high school sweetheart and trying her hand at being a cosmetologist, Jones decided to change her life and become a nurse. She eventually earned her professional nursing license in the 1970s and began working at Bexar County Hospital in San Antonio, Texas, now known as University Hospital of San Antonio. Working in the intensive care unit, where she was surrounded by many critically ill children, was extremely challenging. However, 27-year-old Jones handled it calmly and professionally. Although she had 2 children of her own, their grandmother took over the main care of them, while Jones herself focused on her patients. While many colleagues showered Jones with praise, they began to notice a disturbing trend. Infants and young children were dying at an alarming rate. Frequent cases of cardiac arrests and uncontrolled bleeding, symptoms unrelated to the patient's diagnoses, were alarming. When the number of such cases became double digits, a commission was set up to conduct an internal investigation. It found that about 20 children had died of cardiac arrest or hemorrhage between May and December 1981. It became obvious that something was going wrong. All staff members were interviewed, and one of Jones' co-workers even directly accused her of being involved in the children's deaths. It was a shocking accusation against a respected nurse, but there was no proof. Eventually, the hospital made the decision to no longer staff the NICU. Jones left, and the case was closed. Nevertheless, should the investigation have continued? Were the allegations against Jones something more serious than first thought? Was the hospital or Nurse Jones herself at fault? Despite these questions, it didn't stop her from finding a new job. Jennine Jones took a job with Dr. Kathleen Holland at her small pediatric clinic in Kerrville, Texas. Shortly after she started working there, some of the children started having breathing problems and had to be rushed to the nearest hospital. It was strange and disturbing that the children were starting to get sick after visiting Dr. Kathleen Holland's clinic. Then 15-month-old Chelsea McClellan came in for a routine immunization for epidemic mumps and measles. Jennine Jones administered the injection, and almost immediately Chelsea had a seizure. The little girl was rushed to a hospital in San Antonio, but her heart stopped on the way. Chelsea died. These abnormal cases began to attract attention. Dr. Holland suspected something wrong, and tests revealed a powerful myorelaxant, succinylcholine, in Chelsea's system. Dr. Holland found a bottle of this drug in her clinic with needle puncture marks on the lid, as if some doses had already been used, despite no record of needing or authorizing it. The bottle was partially filled with saline to conceal the fact that the myorelaxant had been used. Only Dr. Holland and Jones had access to the drug. Dr. Holland reported this to the authorities and fired Jones. By this point, the investigation was gaining momentum. Jones was linked to a number of other deaths, up to 60, including at the hospital where she had worked previously. It was a frightening discovery and seemed unthinkable. Could a dedicated nurse really be killing babies? Investigators linked Jones to countless deaths. They didn't even know how to put it all together. Evidence showed that she injected infants with lethal doses of drugs to induce heart failure and hemorrhaging. Some patients she was able to save, but others died. But why? During the 1984 Chelsea murder trial, the media labeled Jones the Angel of Death. Prosecutors suggested that Jones, then 33, was injecting children with drugs to demonstrate a need for the pediatric intensive care unit of a nearby hospital. Other prosecutors claimed Jones led her victims to the brink of death so she could then take action and save them, looking like a heroic miracle worker. She was found guilty and sentenced to 99 years in prison. A little later that year, Jones went on trial again for the poisoning of 4-week-old Roland Santos, which occurred in January 1982. It was strange and alarming that children were beginning to fall ill after visiting Dr. Kathleen Holland's clinic. Things peaked when 15-month-old Chelsea McClellan came in for a routine immunization for epidemic mumps and measles. Jennine Jones administered the injection, and almost immediately the toddler had a seizure. She was rushed to a hospital in San Antonio, but on the way, Chelsea's heart stopped and she died. The abnormal cases began to attract attention. Dr. Holland suspected something wrong, and tests revealed a powerful myorelaxant, succinylcholine, in Chelsea's system. At the clinic, Dr. Holland found a bottle of the drug with needle marks on the cap, as if the doses had already been used, although there was no record of it. The bottle was partially filled with saline to conceal the fact that the myorelaxant had been used. Only Dr. Holland and Jones had access to the drug. Dr. Holland reported her suspicions to the authorities and fired Jones. By this point, the investigation had gained momentum, and Jones was linked to a number of other deaths, up to 60, including at the hospital where she had previously worked. It was a frightening revelation, seemingly unthinkable, a dedicated nurse killing babies. Investigators didn't know how to piece it all together. Evidence showed that Jones was injecting infants with lethal doses of drugs to induce heart failure and hemorrhaging. Some patients survived, others died. But why? During the 1984 Chelsea murder trial, the media dubbed Jones the Angel of Death. Prosecutors suggested that Jones, then 33, was injecting children with drugs to demonstrate a need for the pediatric intensive care unit of a nearby hospital. Other prosecutors said Jones drove her victims to the brink of death so she could then take action and save them, looking like a heroic miracle worker. She was found guilty and sentenced to 99 years in prison. That same year, Jones went on trial again for poisoning 4-week-old Roland Santos in January 1982. Attorneys claimed that she had injected Roland with the blood-thinning drug heparin. Fortunately, this time the victim survived, but Jones was again found guilty and sentenced to 60 years in prison. After Jones' conviction, Bexar County Hospital, fearing further litigation, destroyed many records that could link her to other murders. The true number of Jones' victims would never be known. Years passed, and Jones was repeatedly denied parole. In prison, she was inspired by movies and crime programs. She was rumored to be the prototype for the character Annie Wilkes in Stephen King's Misery. But for the families of the children who died, her actions were painfully real. In 2017, many people knew Jones was about to be released and didn't want to let that happen. Prosecutors filed 5 new murder charges against her related to the deaths of infants while she worked at Bexar County Hospital. The charges involved the murders of Richard Ricky, Nelson, Rosemary Vega, Paul Valerio, Joshua Sawyer in 1981, and Patrick Zavala in 1982. All of these infants, ranging in age from 3 months to 2 years, died from huge doses of myorelaxants and painkillers. In January 2020, Jones, who was 69, took a plea bargain. She pleaded guilty in the death of 11-month-old Joshua Sawyer, and charges in the other deaths were dropped. She was allowed to return a Bible confiscated as evidence because of notes inside. Despite her age and frailty, the parents of the dead children have not forgotten what she did. Joshua's mom expressed joy that Jones would never be free again, wishing her a long and miserable life behind bars. Rosemary Vega's mom, despite the lack of evidence that Jones was involved in her daughter's death, confidently stated that she would never forgive her. The judge, insisting that the plea bargain did not excuse Jones's actions, sentenced her to life in prison. "You have taken God's most precious gift, babies, defenseless babies," he said. "Your final judgment will be in the next life." It was believed Jones would take her last breath behind bars, never to be released until she was 87. She was supposed to be caring for the most vulnerable, but instead decided who would live and who would die. The families of the victims will never forget her actions and will remember the tragedies she caused. Many more shocking details of this chilling story await us.